as the number of cases continues to rise in the country, I do want to remind everybody that the vast majority of people that do become ill with this will recover. At this point, we think at least 80% of people will have mild illnesses that will involve fever and cough, possibly some shortness of breath. Most of those people probably will not seek medical attention because their illness will be so mild. This is an illness that affects people differently at different age spectrums. So one good thing is our children seem to be having very, very mild cases. The children ages 0 to 10 are not getting particularly ill. The death rate in that age group is 0. So your young children are at more risk driving to school than they are from COVID-19. So I do want to reassure you about that and hopefully put your mind a little bit at ease if you have young children. Now, on the other end of the spectrum, our more senior members of our community are at greater risk. That includes, on this definition, those 60 and older. That also includes anyone with chronic medical disease, heart disease, lung disease, diabetes. Those people do seem to be getting more severe cases of COVID-19. And it is our job as a community to do everything we can to help protect them. Currently, the Centers for Disease Control and Prevention are recommending that anyone that's high risk start practicing something called social distancing. What that means is when you're out in public, we recommend that you do your very best to maintain about 6 feet between you and the next person. Avoid large crowds. You still can go to the grocery store, you still can go to the drugstore, but do your best to go at times that aren't quite as busy so that you won't be around so many people. And it's really important that we do all follow the Centers for Disease Control and Prevention guidelines. I've heard a lot of people say, hey, I'm 30 years old, I don't have medical problems, even if I get it, it'll be mild, I don't need to worry about any of that. And while that is probably true, that if you are 30 and healthy and you do get it, you will probably have a mild illness, I can pretty much guarantee you know and love somebody over the age of 60, you know and love somebody with heart disease or lung disease or diabetes. And it is our responsibility to help keep them safe. And by following these guidelines, we can keep each other safe and healthy. There are also many things that you can do right now to help keep you and your family safe and to help keep our community safe. First and foremost, wash your hands. Secondly, if you are sick, please stay home. And please follow the advice of your doctor. This is an illness that we know people can spread for longer than normal illnesses, which is why you see on the news that people are being asked to stay inside for 14 days, for example. So please do follow the advice of your doctor. That is there to help keep us all safe. Next, please follow the Centers for Disease Control and Prevention's recommendations. These recommendations are changing every single day, so I encourage you to check the website on a pretty frequent basis. And any recommendations that are made, such as social distancing or whatever they may be, please follow them. And please know that they are being made for the good of our entire community. And if we all do these things, we really can help minimize the spread in our community, illness. We really can have an impact on this disease. So I want everyone to know that and feel empowered to do something to help. And we at ETSU Health are committed to keeping you and your family as safe as we can during this pandemic and keeping you informed.